Started. Thank you everyone for joining us. Welcome to the latest Duke media briefing on the COVID-19 pandemic and its effects on society. I'm Gregory Phillips with Duke Communications and I'm moderating this event. Halloween is next week, with Thanksgiving, Christmas and other winter holidays close behind. Millions of people have been staying distanced for months, which makes the desire to gather for the holidays even stronger this year. But can it be done safely? We have three Duke physicians with us today to discuss how to plan for traveling, gathering and eating for the holidays during the pandemic. I'll introduce our speakers and get the discussion started, then we'll open it up to questions. Thanks to those of you who already sent questions. If you're joining us on Zoom, you can submit questions via the Q&A window at any time. There will also be an opportunity to ask questions in person in a few minutes. Thanks also to everyone watching this on YouTube. With us today is Cameron Wolfe. He is an infectious disease specialist at Duke Health and an associate professor at the School of Medicine, where he studies infectious diseases and biological and emergency preparedness for hospital systems. Good morning to you.
Good morning.
Also joining us is Emmanuel Jr. He is a professor of pediatrics at the School of Medicine and is also chief medical officer of the Duke Human Vaccine Institute, where he directs the Duke Vaccine and Trials Unit. Good morning.
Good morning, everyone.
And we have Viviana Martinez-Bianchi. She is a primary care doctor at Duke Family Medicine, where she's also director of health equity and an associate professor in family medicine and community health at the School of Medicine. Dr. Martinez-Bianchi will give her answers in English and Spanish today for the benefit of our Spanish-speaking audiences. Good morning to you.
Good morning, buenos dias.
Thank you. Dr. Walter, we'll start with you. The thought of kids going door to door trick-or-treating feels very different than it did last year. Can that be done safely? And are there any alternatives you can suggest?
Yeah, thanks for the question, Greg. I think this year, obviously, different than past years. We're in the middle of a pandemic, with the pandemic starting to reach or starting its second surge here. And I think there are a lot of concerning indicators, with the number of cases going up, hospitalizations and deaths going up here locally and across the country. So I think trick or treat will not be as normal this year. And understanding that everybody's kind of fatigued from COVID, I just have real concerns about trick or treat as usual, going door to door like we usually think about in large crowds or large crowds of kids. So I think that's just a perfect way to potentially spread the virus. I think there are a lot of alternate ways that we could look at for celebrating trick or treat, Halloween. That we can think about. People could do with their kids. They can do pumpkin carving at home. They could potentially even do it in some smaller groups, socially distanced, making sure that they do things like wearing masks and sanitizing. Other things that could be done, you could do like a home scavenger hunt with candy, just kind of keeping it small. You might consider doing a home movie night instead. For those that are so compelled that they really want to do a trick or treat, and I can see Cam smiling there with his kids. My kids are all out of that age range, but I do have grandkids. What I would advise is that you not do it in large groups, that you keep it really small if you really feel compelled. If you're a person that's handing out candy, then you might consider putting the candy at the end of your driveway on a table in little bags, realizing that kids may grab them all, but that's one thing that you might consider to keep it safe. I think parents should make sure that their children are wearing masks and not Halloween masks. I think they need to wear a cloth or a surgical mask if they have access to those that they might have, and not a Halloween mask over that. Maybe just incorporate that into their costume. And then also they ought to carry hand sanitizer with them. So those would be my recommendations to try and keep it safe if you're trick-or-treating. So.
Gotcha. Thank you very much. And I'm sure we'll come back to that. For now, Dr. Wolfe, I'd like to move on to you. Beyond Halloween, what should people keep in mind if they're thinking about traveling for the holidays? How risky is it, and how should people weigh those risks?
Yeah, thanks so much, Greg. I might actually, if you don't mind, just add back onto what Chip had said. We sort of think of Halloween as a young kid event. I have a 5 and a 7-year-old. They're excited about this, but I think we should also reflect that for many towns, particularly college towns, for example, Halloween is a big teenager and celebration in your 20s and beyond. So let's not forget that it can be a very congregate and tight gathered activity for lots of not so young individuals too. And I think for those aged people, we also need to be thoughtful about how we sort of think about Halloween. But in answer to your travel question, I think like Chip had said, that there are some concerning numbers across the country, and I think as we start thinking about activities like Thanksgiving, where travel is going to be, in any given year it's an enormous travel weekend. I think statistically the busiest in the United States. I fear that if we don't consider that differently this year, we'll be getting ourselves into trouble. And so travel is a congregate activity by its very nature. But I think there are ways of sort of mitigating that. The first is, many of us fly over Halloween. I think Thanksgiving, of all of the weeks when it's important to consider whether or not I can actually travel by car, therefore staying in my family congregate, that would be a better choice from a safety point of view this year, at least. I think the other thing is to say, if you have to travel and you have to travel in a way that involves public transport, be mindful of the groups that are around you. Wear your mask. In fact, I encourage people who are at higher risk under those circumstances to actually have an N95 mask for themselves, not just a cloth mask or a surgical one, although any mask is clearly orders of magnitude better than none. Like Chip said, hand washing is still important. We've hammered the masking message, I think, a little bit, but we still need to be respectful of the fact that this virus survives on surfaces much longer than many typical viruses like flu. So hand washing remains important. And there's activities that we do that we don't normally think about that in our travel, I think, are higher risk. So for example, when you sit in the waiting room, the waiting wing of the airport, that is a busy place with lots of people around. And I think people would do themselves well to be very sensitive to the groups of people around them, perhaps not stop for that extra meal in the airport waiting room before they jump on the plane where they're all sitting down with lots of masks down, and be thoughtful about those sorts of activities. I actually encourage folks to take a second mask when they're going too, because it's how often do we get there and we find the ear loop snaps or something and you've got 5 hours sitting beside someone on a plane. I think you've got lots of opportunities to be really thoughtful this year, if in fact you want to travel at all. And that may be actually the biggest issue, is to say, look, hey, there's been lots of things that are unusual this year. Maybe traveling for Thanksgiving may in fact be something that people can defer for 12 months.
Sure, thank you very much. And certainly with lots more to follow up on there. But Dr. Martinez-Bianchi, I'd like to move on to you. Of course, the flip side of traveling is the idea of having people gather in your home. How should people approach hosting holiday gatherings this year? Can that be done safely? And if so, how?
Well, as we mentioned, it is a different and difficult year, and we have to plan appropriately to avoid becoming ill or making others sick with COVID-19. First of all, if you or anyone in your household has symptoms of COVID-19 or the flu, is waiting for COVID-19 viral test results, or may have been exposed to someone with COVID-19 in the last 14 days, then do not host or participate in any in-person gatherings where you could get others infected if they are not the members of your own household. In these cases, if you are a person on quarantine or in isolation, then you should celebrate only with those who you may have to quarantine together, your family members, the people who live under your same roof, your roommates. And then avoid larger gatherings to avoid passing this on to others. Ante todo, lo más importante durante estas fiestas es no organizar ni participar en reuniones en persona. Si usted o alguien en su hogar tiene síntomas de COVID-19 o gripe, está esperando los resultados de la prueba viral para saber si tiene o no el virus, puede haber estado expuesto a alguien con COVID-19 en los últimos 14 días, entonces le toca hacer cuarentena, le toca aislarse y no estar contagiando a otras personas. En ese caso, conviene celebrar la fiesta solo, con quienes puedan estar en cuarentena o en aislamiento, las personas que viven en su casa. But now there are also safe and unsafe ways to gather for the holidays. So the CDC has told us about, they divided about lower risk, middle risk, and high risk activities. So a low risk activity for the holidays will be to have a small dinner with only the people who live in your household, the people who live under your same roof. Think about preparing traditional family recipes for family and neighbors. Especially, you could think about preparing your meals and maybe delivering it to the door of somebody who may be at high risk of severe illness from COVID-19 that needs to isolate. You could have a virtual dinner and share recipes with friends and family, toasts, stories. On shopping day, Box Day, shop online rather than in person, so that you're not exposing yourself to crowds in the stores. And then watch sports events, parades, and movies from home. So hay formas seguras de reunirse para la fiesta. Las actividades de menor riesgo son tener una cena pequeña, solo con las personas que viven en su hogar, preparar recetas familiares tradicionales para familiares y vecinos, hacer alguna comida especial y llevársela a ese vecino o esa familia que es de alto riesgo o que puede estar enferma con COVID-19 y queremos entregarles, llevarle la comida de una manera que no implique el contacto con otras personas. Puedes tener una cena virtual, compartir recetas con amigos y familias, y si quiere hacer las compras del día siguiente de Thanksgiving, hacerlo en persona, en vez de hacerlo en persona, hacerlo en línea, ¿verdad? Y ver eventos deportivos, desfiles y películas desde la casa. So those are the low risk activities, and there are moderate risk activities. For example, having a small outdoor dinner with family and friends who live in your community. Lower your risk by doing it outdoors. If you must have other people, make sure if you're indoors, open the windows so there's good ventilation. It's not a crowded and secluded place. If you're gonna go go into a pumpkin patch, review which are the pumpkin patches that are using hand sanitizer before touching pumpkins, where people are wearing masks, where the wearing of the mask is encouraged and enforced. And then look for people who are able to maintain social distancing. And, are people staying 6 feet apart? And then attending small outdoor sports events with safety precautions in place. Y las actividades de riesgo moderado son tener una pequeña cena al aire libre con familiares y amigos que viven en la comunidad, reducir el riesgo siguiendo las recomendaciones del CDC, de hacerlas afuera, o si van a ser adentro, abriendo bien las puertas, y se va a ir a buscar comprar calabazas o huertos, ir a lugares donde la gente esté utilizando los desinfectantes de manos antes de tocar las calabazas, y donde se alienta o se impone usar las máscaras, y donde las personas puedan mantener el distanciamiento social. Y además asistir a pequeños eventos deportivos que son al aire libre en donde hay distancia social. I wanted to also make a note of Day of the Dead, which is also coming up soon for the Latino community. And for those, we can think of preparing traditional family recipes, playing the music in the home of those people who were deceased, making and decorating masks, or making an altar for the deceased in the home, using pillows. But think of things where you're not really involving the regular crowds that you would have involved during typical times. Y para el Día de los Muertos, también hacer música en la casa, pero mantener el grupo pequeño, decorar máscaras, escuchar la música de las personas muertas, unirse a celebraciones virtuales, etc.
Excellent. Thank you, Dr. Martinez, and thank you to all of our panelists for those comprehensive opening answers. We've certainly got lots to dig into here. I would remind everybody on the call that you can submit questions via the Q&A window, and I can ask them for you, or if you prefer, you can raise your hand in Zoom so that you can ask your question in person. And if you're joining us by cell phone, you can hit *9 to request to raise your hand so that we can unmute you. But we've had some questions come in already, so we'll kind of work through these. And I'd like to hear from all of the panelists on this one. A question we had from the Washington Post asking what research currently informs ideas about the risks of household transmission. For example, the attack rate within a typical household. Dr. Wolfe, would you like to start us off on this one?
Sure. You know, it's a great question, and there's probably a couple of major studies that would point towards some of that effort. You know, one of the earliest ones I think was probably back in June, where we started to get publications. I think the Lancet had a good sort of retrospective cohort looking at within Guangzhou in China, how many sort of household members became infected after someone had COVID within the household. And they would sort of sit, depending on how you define household members, they would sort of come up with somewhere between 12 to 17%. But I think the definition of household members there is really crucial because, you know, when we think about the setup of many of our different socioeconomically derived homes, they can be very different. You know, what my family setup may be quite different to other members. That gave us sort of the first hint of sort of intimate, close transmission. I think the other one that sort of stood out for me was actually retrospectively looking back on the very contained transmissions that were occurring on some of the early cruise ships. It's not quite a house, but it's a containment zone where you really, you know, can examine transmission pretty closely. And what was very clear in some of those cases, for example, the Diamond Princess in Yokohama had, you know, the more people that were in the room with you, the higher the transmission rate, not surprisingly. And I think for folks where there were 4 per sort of room, almost equivalent to a household, you were sort of getting transmission rates then of sort of upwards of 20 or 30%. I think I'd have to look at the exact statistic. It's very proportional to density. And I'd be interested in what my colleagues then say in terms of how you would apply the sort of the density thought process to different households. And, you know, also who is the household member, I think becomes really crucial there. So, you know, if it's myself, a wife and 2 kids within a small confine, then clearly we're going to have lots of contact within that little group, but maybe our sort of extended family may not come very close. That's very different in certain populations, but they would be the 2 studies that I would start with, sort of averaging in the teens to 20s. I think my colleagues would probably have their own experiences on this too, though.
Thanks, Cam. Yeah, I think a lot of it depends on your, as you note, your living situation and the density within your household. Not, you know, here I do pediatric practice, and my experience from, you know, if you have an infected, for example, parent, and you have a fairly dense living situation with a lot of people in one house, that the attack rate in the household is, you know, appears to be much higher. You may have, if you have 3 or 4 children coming in from that house, you know, often if it's 4, 3 will test positive, or, you know, if it's 3, 2 will test positive. So I think it really depends from individual household to household, what, you know, what your living situation is. So Viviana may want to comment as well.
Dr. Martinez, have you got something you'd like to add?
Yeah, I heard the question yesterday, and thank you so much for asking it, because it took me to reflection and to looking at what studies had been done. And as it was mentioned before, this rate of transmission between 8 and 18%, yet we have contact tracers who are telling us that sometimes they call the contacts of a positive case that has been identified, and they hear that the whole family unit is sick with the symptoms of COVID-19. So I really think it will be wonderful to start looking at studies that are looking at what is the data that contact tracers are collecting, what are the stories that they're hearing. In primary care, we often are seeing, like Dr. Walter mentioned earlier, that whole family units are sick. We also see that depending on the initial case or who was sick, if it's somebody who's coughing a lot, it has a lot of secretions, then it's more likely that family members are also going to become infected as well. And then the severity rate, how severe they are, it will depend also on how, what are their predisposing conditions. Often we had seen reports or families that we have taken care of where maybe the younger person was a factory worker, got sick at a meatpacking plant, went home where grandmother, their older parent takes care of their children while they're at work, and then the older parent is the one that ended up in the intensive care unit and might have even died. Well, and then the kids also were sick, but the one that ends up being ill is the one that had diabetes or other predisposing problems. Lo que hemos estado viendo con respecto a la transmisión es que estamos encontrando lo que está publicado habla de un riesgo de transmisión a las personas de la familia entre 8 al 18%, pero sabemos de historias de los traceadores de contacto que nos cuentan que hablan por teléfono a una persona que es positivo y resulta que toda la familia es positiva. O sea que quizás nos falta generar mayor cantidad de información a través de lo que están aprendiendo los traceadores de contacto de los departamentos de salud, y también lo que estamos viendo desde la atención primaria de salud como médicos de familia, como pediatras, es que nos encontramos con familias en donde llamamos por teléfono y toda la familia ya está enferma, o que quizás una persona joven la adquirió, la lleva a la casa y luego la madre o la abuela que vive con ellos, que le cuida a los niños cuando van al trabajo, es la persona que termina yendo a la terapia intensiva porque es la persona que ya tenía diabetes preexistente. Otra cosa que vemos es cuando dentro de una familia una persona con mucha tos, donde tiene el COVID con más cantidad de secreciones, luego el resto de la familia es más común que se infecte. Muchas gracias.
Thank you.
If I could add one piece again, sorry to interject. I mean, I think one of the things that we're also trying to figure out, and some colleagues here at Duke are looking into, is to better understand household and close contact transmissions. So well before COVID, some groups within our genomic core had actually a project up and running where they were trying to look at suspected viral infection and see if they could preempt when those infections would be transmitted or when people who may have been exposed were about to become sick. And they were able to sort of alter that subtly as COVID emerged to really look at individual people who've been positive, cast a net around their sort of school or college or family close networks, and really try and better understand how virus transmits between all those different individuals. So we are starting to get some information on viral dynamics, and I think in exactly following along what Chip and Viviana had mentioned, it's dependent on who the person is who's positive in the household, what sort of intimacy of the contacts that they have, and then also sort of, it's not just the household, it's the household plus who travels with you to work, what's the work transport like, what's the environment at work, who comes back into the house. It's much more complex than just thinking about a statistic within a household. The final thing I would wanted to add here too is we're also getting some really good data starting to come out of tertiary education facilities. So understanding transmission within the home when the home is a dormitory. That's a very different sort of transmission capable environment. And I think as we're seeing universities across the country open in different ways and try and mitigate COVID in different ways, we're learning a lot about what can be successful there or what facilitates easy transmission.
Excellent, thank you. And thank you for adding that. We've got lots of questions coming in, so we're gonna get through as many of these as we can. Dr. Wolfe, I wanted to follow up on something you mentioned earlier about Halloween not just being for children. Obviously, under normal circumstances, you'd see lots of Halloween parties, grown-ups, teenagers, college students having these kind of things. But we've also already heard today about the issue of being asymptomatic and still infectious. So again, even if it's restating some of our points, what do you think people should bear in mind if they're thinking, oh, well, I still want to have a Halloween party, I can do that, right? What should people be kind of thinking about, or what kind of decisions should they be making when they're adults wanting to celebrate Halloween? Dr. Walter, any take on, or whoever wants to go first?
Oh, okay. Well, I'll start and I'll let Cam, since he brought up the adults and I'm the pediatrician. But, you know, I think the recommendation, as Viviana had mentioned, you know, number one, if you have COVID or if you've been exposed to someone with COVID, you really should follow recommendations and not be participating in any Halloween or trick-or-treat type activities. So I would like to emphasize that to begin with. I think, you know, the risk, probably the biggest risk is really a bigger risk is social gatherings with, you know, older teens and young adults for Halloween festivities. And, you know, those are very, very common. And I think if you potentially mix alcohol in with those type of events, you really risk a high transmission kind of super spreader type event, depending upon how big the event is. So, you know, I really would caution people against larger gatherings on Halloween or trick or treat and parties that we think of. Other things that people do, hay rides that are with larger groups, et cetera. And there really is some very good, if people go to the Centers for Disease Control website, there's some really very good and specific advice for all the holidays, including Halloween, to look at. So I would encourage people to do that.
Thank you. And Dr. Wolfe, I'm curious if you could talk a little bit more about this asymptomatic transmission. I know it varies between age groups. And what do we know about whether there are particular age groups in which we're more likely to see asymptomatic transmission?
Yeah, it's a good question, Greg. You know, I think generally speaking, the younger children have if not asymptomatic, minimally symptomatic disease. We're certainly very clear on that. I think as it pertains to Halloween, the temptation, and heck, this is true in most of our activities, the temptation is to think that, look, hey, I might have been exposed, but hey, it was 7, 8, 10 days ago. I'm feeling fine. Therefore, I can continue hosting the dinner party that I was planning for, or the Halloween festival, or hey, I know all my friends and college buddies are heading out tonight and I feel okay, so I'm probably fine, I'll go out. I think what we do know in that sort of situation is, depending on the study and the environment, you're probably looking somewhere between 35 to 55% of otherwise young, healthy adults who can be very capable shedders of COVID, infected themselves, infectious to other people around them to varying degrees, and yet be completely asymptomatic. Or maybe their symptoms are a sore throat, scratchy throat, and they think it's pollen, or they think it's allergies, or they're not sure what it is. Maybe they've been yelling too much and they're thinking it's their, or too many Zoom calls and their throat's getting sore. Those people can be very capable transmitters. You know, when we've looked on our college campus at the amount of virus that's shed by different students, I am consistently shocked at some of the most prolific shedders of COVID are completely asymptomatic. So if there's a message there, it's please don't fool yourself into believing that you're safe. Now I'm getting a scratchy throat by thinking about it. Please don't fool yourself by thinking that you're safe just because your symptoms aren't there. If you know you've had an exposure and someone has traced you and said, look, I think you need to be on a 14-day quarantine, please take that seriously, even if you're feeling well, because there's a reasonable chance that you can be infected and not know.
Excellent, thank you. And Dr. Martinez, if there's anything you've got to add about asymptomatic transmission, I'd love to hear that too.
No, voy a decir en español lo que decía el Dr. Wolfe. I'm going to repeat in Spanish what Dr. Wolfe was saying. I think there is hay tanto riesgo de transmisión para las personas que son asintomáticas. El hecho de que si a usted lo han contactado y le han dicho que es el contacto de una persona que tiene el virus, tiene que hacer la cuarentena de los 14 días y no pensar que, porque mis síntomas son leves o porque porque me dio negativo el test en el segundo día. Tenemos igual que esperar los 14 días. Estamos viendo transmisión de personas que no tienen síntomas, que están transmitiendo virus en cantidades muy, muy grandes. Y esos son los casos que en las fiestas nos preocupa tanto, que van a terminar enfermando a los miembros de su familia, las abuelas, las personas que pueden tener diabetes, obesidad u otros factores de riesgo. Entonces es muy, pero muy importante que si han sido contactados, si saben que han estado expuestos a una persona que tiene el COVID-19 o la gripe, que se queden en la casa por esos 14 días, que mantengan el aislamiento necesario para evitar seguir propagando la infección.
Excellent. Thank you to our panelists for that. Dr. Wolfe, you talked about travel and some of the ways that maybe we can travel safely if we are traveling. I'm wondering, we've had some questions come in about how important is it to consider the current rate of cases in a destination? If you're traveling to another city, is that something that we should be monitoring? And is it a case where if we are in a city where the rates are maybe higher, we should think twice about traveling and also think twice about inviting people to join us for the holidays?
Yeah, it's a really good question. I mean, I think the first sad reality is probably no place in the United States that's free of COVID. Let's put that on the table. So I don't think that you should reassure yourself that you can take your mask down if you happen to be going to, I don't know, New Hampshire, although rates probably are less there. I think it is a true statement to say that it is worthwhile being aware of what the risk where you're moving to and what that looks like. If I knew Chapel Hill, where I'm talking to you from, had particularly high transmission rates in the next week, I would be less inclined to host a gathering. No question about that. So, travel is always more complicated because particularly if you involve airlines, you're invariably involving mixing of people from all sorts of different locations. So it's not as if I travel from here to Atlanta that I'm only intermingling with people from Raleigh and Atlanta. So I think the travel is its own independent risk because of the intensity of the mingling of people who are at both sides of the airport and on the plane. It is worth people considering the size of their gathering, the numbers of people who they wanted to have and where they're hosting it, like we talked about. Can it be done inside? Can it be done outside if possible? Can the windows be open? All those sorts of activities we just talked about. And I think it's a fair point to say, what's the level of COVID in your area? Actually, there's a wonderful website that I've found very informative to teach patients with, that's hosted out of the Georgia Tech IT and engineering group, that actually allows you to put in county-specific details, and it's updated weekly. That says, right, if I'm hosting an activity of 10 or 25 or 50 or 100 people, what's the likelihood statistically that someone in that group will have COVID? And it can give you very granular and updated information on sort of rates of transmission and what does that mean to even be in a gathering. I found that very informative. People can look at that and they go, well, boy, there's a 90% chance that someone in the church today is going to be positive. I might defer and continue on Zoom church. And so I think there are ways of being aware of the data in the areas where you are and the areas where you're traveling to that can be very informative.
Sure, absolutely. Thank you. And if you can share that website with me, I'll have it in case any reporters would like it after the briefing. Dr. Walter, I'd like to come back to this notion of Halloween. We've had some follow-up questions. You gave some very helpful suggestions at the beginning of the briefing about things to bear in mind. And we've had some follow-ups on that. People would like to know, when you think about keeping groups of kids trick-or-treating small, if people are going to do that, how small is good? How many kids are we talking about? Should it be no more than 2? And I realize these things are nebulous, but any guidance you can give on that, people would appreciate. And where you see the biggest risks are in trick-or-treating. Is it the knocking on the door? Is it the eating of the candy? Should parents be kind of saying no candy, or what can they do to maybe make candy safer, if that's even possible?
Yeah, so I think there's a lot wrapped into that one question. It's a really good question. I think probably the safest, obviously, is doing an activity at home. So maybe having a scavenger hunt inside your own home with your home group. If that's not palatable to you or your children, and you really feel so compelled, then then I think, and they want to go out and trick or treat, probably just going it within your family group would be what I would advise, and going to a limited number of homes, and maybe potentially people that you know very well, just to keep it on a limited basis. I think in terms of candy and children, I think after they, if they're reaching into a bowl to pick out candy, I think that would be, and other people have reached in that bowl, that would be the time I might grab the hand sanitizer and share it with my children under supervision to use. The safest thing is if people have maybe grab bags where you grab one thing at a time, although that's a little bit difficult to control. Would I go so far as sanitizing the wrappers on my children's candy when I got home? Good luck with that. I don't know that I would go that far. You might run more risk doing that. So and children are going to be children and eat their candy before you get home. So I think I would not be so prescriptive as to say that, but I do think there are things, keeping the group small, taking hand sanitizer, wearing a mask, avoid long contacts, don't go into people's houses when you're trick-or-treating.
Sure. And you mentioned the mask. We've had another question about that, and I'd like you just to reiterate, you mentioned this earlier, how excuse me, a Halloween mask is not a COVID mask. And could you kind of reiterate that it's important to not just assume, oh, if I'm wearing a witch mask or a skeleton mask, then it's just as good as anything else?
A Halloween mask is definitely not protective. So the best thing would be to get a cloth mask that would be protective, and kind of try to figure a way to incorporate that into the costume this year and make it fun. I think that would be, and I'm probably not the most creative person at doing that, but I'm sure there are a lot of creative people out there that can figure a good way to do that. So.
Absolutely, thank you. Dr. Martinez-Bianchi, when we talked back in the summer, this was a topic, and the question has come up again. How concerned are you that people are delaying and skipping regular medical appointments or avoiding getting the flu shot out of either fear of going to the doctor's office because they're concerned about being around other people? How important is it that people should be keeping the regular appointments, and in particular getting a flu shot right now?
Getting the flu shot right now is extremely important. We have one viral illness that we can actually help to prevent spread, and we don't want to end up crowding hospitals with people with influenza when it's something that we have a vaccine for, right? So we really want to go and get your vaccine for the flu. Make sure you do it. If you have chronic medical conditions, you want to keep them on check. You want to treat your hypertension. You want to treat your diabetes. You want to make sure if you have asthma or other things that you tend to have exacerbations for in the winter, check with your primary care doctor, check with your family doctor, your pediatrician, or your internal medicine doctor to make sure that you have your medications, that you're up to date with everything that needs to be taken care of. We don't want this. We are already going through a pandemic of a viral illness. We don't want a second pandemia of the problems that went untreated or unchecked. So si tiene otras condiciones, tenga sus medicamentos, hágase la pregunta era qué es lo que tenemos que hacer con respecto a otras enfermedades crónicas que tengamos. Hay que mantenerse al tanto del cuidado de nuestros problemas. Si tenemos diabetes, hipertensión, problemas cardíacos, vayan a ver a su médico. Si esos niños tienen asma o otras condiciones, también que tengan sus inhaladores y todas sus medicinas al día, que estén listos para mantener el cuidado de otras enfermedades. Y lo otro es hacerse la vacuna de la influenza. Tenemos que evitar que haya tanta cantidad de influenza que luego se llenen los hospitales también por influenza y que aumentemos y que no tengamos capacidad hospitalaria. So yes, get your flu shot, make sure you do it. Hágase la vacuna contra la gripe.
Excellent. Thank you all for that. Still got the questions coming in. That's great. Keep them coming. We'll get to as many of them as we can. Dr. Wolfe, I'll come back to you. We've had a question about college students. Obviously, lots of college students are staying on campus and hopefully most of them following guidelines. But are there any recommendations about college students coming home for the holidays? You know, we're seeing some that are planning to stay where they are, some where they're going home. What kind of risks are present in both those cases? What should people be thinking about when making those decisions?
Yeah, actually, that's something we're thinking about a lot, actually. So I think there's two sort of fundamentals there, isn't there? The first is campuses have in fact intentionally changed their academic year, if you will, to have it end around Thanksgiving. And part of the reasoning there is that we recognize travel as a risk. Travel is an added risk. Travel moves your little bubble of people who you hang around with and engages another bubble with the people who you hang around, who you weren't hanging around with, blends risk, and then potentially you bring it back to your college campus. So I think the response to that most colleges have done is to simply say, hey, look, we'll end our academic year at the end of Thanksgiving. From our end, I think we've sort of approached it recognizing also that not everyone goes home. You know, if you're a grad student, if you're an international student, traveling home and not coming back for further parts of December may not be possible. So we've started to actually go through in a very sort of systematic way and say, look, you know, if you have to travel at all, like we said earlier, let's consider a car travel rather than airline travel if you can. If you have to travel, consider it to be a one-way travel where you don't need to come back in December, and you maybe can do more virtual stuff at that point if you prefer. Or if you know you're going to have to travel somewhere and then have to come back, really try and think about the 2 weeks leading up to Thanksgiving, for example, that travel period, as your pre-quarantine. Think about it as the time when you can do the best thing for yourself to actually minimize the risk that you may inadvertently bring COVID to parents, grandparents, loved ones. And similarly, tell the rest of your family the same thing, is to say, look, you know, the preparation for Thanksgiving begins 10 to 14 days before such a gathering would actually take place and such travel occurs. And I think if folks can be mindful of that, then we've minimized the chance of someone inadvertently picking up or carrying COVID into higher risk situations. For us, we've also taken a slightly more aggressive approach on the campus in terms of also testing individuals for COVID to make sure they're not minimally or asymptomatically transmitting upon their return. And we think that's a beneficial way when they then come back into a dormitory or congregate living sort of activity or back to class, that we further mitigate risk. So do you need to come back at all? Do you need to travel at all? And if so, can you really think in the sort of weeks leading up to that, how do I minimize the chance of accidentally making someone else sick?
Sure, thank you very much. Dr. Walter, pediatrics question for you. We've had a question come in wondering about whether children are tested less frequently because it appears that the virus doesn't affect them as severely, or are there any concerns? It seems like people have general concerns that maybe in children symptoms are being written off as maybe a cold when it could be COVID. I mean, how do you kind of approach this kind of assessing children as potential carriers of COVID? Is it basically the time to get them tested is exactly the same as adults? Or is it the case that because children seem to get fever so often and cold symptoms so often, should we treat them any differently?
The answer is really no. In my clinical practice, where I'm seeing, children on a regular basis, what we do in clinic, if the parent calls in and reports any symptoms which may suggest COVID, so if they have fever or any respiratory symptoms or diarrhea, for example, and GI symptoms that may go along with COVID, then we usually will set those kids up to get COVID tested first. That's our recommendation. obviously, if the parent wants the child to be seen, or if there's an indication for the child to be seen in clinic, we'll do that as well. The other kids that we're regularly testing for COVID are those that have exposure. So if they have a parent who has COVID, or a family member, sibling that has COVID, or if they've had an exposure at school or daycare, we're routinely testing those kids. Usually we'll wait a period after their exposure to make sure that you know, when they would likely be positive. So probably about 5 to 6 days after exposure, then we'll bring the children in and test them. So, but we are regularly testing kids. You know, children can get COVID. They, as Dr. Wolfe mentioned, they tend not to get as sick as adults with COVID and older adults with COVID, but certainly they can get sick, and some children can get quite ill. So, and the other thing is we want to really determine whether they have infection, because they can spread it to family members and or particularly grandparents, aunts, uncles who may be older.
Sure, thank you, Dr. Walter. Just a reminder to everybody, you can submit questions via the Q&A window if you have them. I'm going to move on through some more. Dr. Martinez-Bianchi, we've had a question from K-Pasa asking if you could expand a little bit on your suggestions for celebrating the Day of the Dead and how that can be done safely and responsibly.
All right, thank you for the question. I'm going to talk about safe ways for the Day of the Dead. For those in the audience, especially Mexican families, a lot of Latino families will prepare an altar that honors the dead, and there's often lots of different activities that go around the Day of the Dead. To make it safe, you want to prepare, you want to do things avoid the larger gatherings. You want to prepare, for example, traditional family recipes for family and neighbors, play music in your home that your deceased loved ones enjoyed. If you prepare recipes, don't share, you know, don't host a large dinner, but you could actually get some of the meals to other people who may not be able to cook themselves because they are sick. You could work with your kids to make and decorate masks or making an altar. You can set out pillows and blankets in your home intended for the deceased to rest. You can join a virtual get together. Entonces las formas más leves que van a causar menos problemas sería, por ejemplo, preparar recetas familiares tradicionales y dejarla en la puerta a personas que estén enfermas, o aquellos que tengan mayor riesgo de enfermedad, entregar de una manera que no implique el contacto con otras personas, hacer tocar música en el hogar para que disfruten sus seres queridos fallecidos, hacer y decorar máscaras, o hacer un altar para los difuntos en la casa, pero limitarlo al grupo de la familia que vive junto, y unirse en una celebración virtual en reunión. There are moderate risk activities, for example, having a small group outdoor open air parade where people are distanced more than 6 feet apart. If you're going to do a little parade, make sure that you're maintaining that 6-foot distance. Visiting and decorating graves of loved ones with household members only, and keeping more than 6 feet away from others. So if you're going to go to the cemetery, do it, but keep that distance. And then if you want to host a small dinner, because you must, you do it with your local family and friends, do it outdoor. And again, you may have this family here and then 6 feet apart, another table for another family. Una cosa de actividad moderada de riesgo sería tener un desfile de grupos pequeños al aire libre, donde las personas están separadas por más de 6 pies, visitar y decorar las tumbas de los seres queridos, pero igual siempre manteniendo esas 6 pies de distancia. También mantenerse, por ejemplo, si decidimos hacer una cena al aire libre, podemos hacerla en el jardín o en el parque, y entonces una familia aquí, esta familia separada de la otra por 6 pies de distancia. Y lo más importante es evitar, and the most important thing is to avoid high risk activities during Day of the Dead, so that we we avoid high-risk activities to prevent the spread of the virus. You don't want to attend large indoor celebrations with singing or chanting. Es muy importante que no asista a grandes celebraciones en el interior cerrados donde se hacen cantos, cánticos, y coros. Avoid participating in crowded indoor gatherings or events. Avoid having a large dinner party with people from different households coming from different geographic locations. And then avoid using alcohol or drug, which can cloud judgment and increase risky behavior. También evite participar en reuniones o eventos en el interior de las casas llenas de gente. Evite tener una gran cena con personas de diferentes hogares que provienen de diferentes ubicaciones geográficas, por eso de estar trayendo el virus de otras comunidades donde hay mayor cantidad. Y evite consumir alcohol o drogas que pueden nublar el juicio y aumentar los comportamientos de riesgo que hacen que se transmitan más. Pero hay una forma de poder celebrarlo y es muchas veces con la familia con la que vivimos bajo el mismo techo, hablando de las personas queridas y haciendo las cosas más lindas, pensando en la vida que vivieron.
Excellent. Thank you very much. Dr. Wolfe, we'll come back to you, and I'm certainly interested in everybody's take on this. Supplemental funding for public health departments under the CARES Act expires at the end of the year, and so far, obviously, another relief package doesn't seem to be forthcoming. Could that be right before a potential post-holiday surge in cases? And are you concerned that that lack of funding could exacerbate the situation in the new year?
Yes. I mean, let's get into the meat of that, but yes is the clear-cut answer. So I think there's two parts of that, isn't there? Number one, what we are seeing is an increase in cases. We are seeing projections that they will probably get worse before they get better. And I think that there's a number of activities that we've been talking about in the next couple of months that will potentially act as spreading capable events. So yes, I'm concerned that numbers will continue to increase, whether or not we even get a concomitant serious flu in year. So the second thing is you apply that to public health groups that have, to be honest, had their budgets stretched incredibly thin over the last 12 months if they were well funded in the first place. And so, for us locally, a number of our local health departments for whom we have a footprint on have had benefits from the CARES Act in the way that they apply testing, in the way that they've been able to internally move human resources to sort of cope with surges when they've occurred. And so I'll be honest, we're in early stages of discussing with them as to what this would look like potentially as we move into January and February. Because the other big thing that's going to occur there that's going to need enormous public health resources is the rollout of a vaccine. And so it's one thing to understand the response from public health and the response from academia to actual clinical disease. It's quite another thing to understand the resources required to roll out a vaccine, if in fact that becomes available during the same sort of late winter period as I think we may project. So there's a lot of logistics there that have got to come through, and the last thing I would wish for is for good public health to be battered around by financial restrictions because we can't get our individuals to agree on what would be a reasonable strategy for financing. So yes is the answer. I am worried.
Gotcha. Thank you very much. Dr. Walter, go ahead.
Yeah, I would add on to what Cam said and really just say, yes, I have big concerns. Clearly, I think, this pandemic has shown a lot of the issues with a public health system that's been underfunded for years. And then, I think to not extend extra funding to try and help with this pandemic situation would be a big mistake. So especially as Cam suggests, as we're dealing with a surge in cases and also trying to roll out a vaccine at the same time, which is really going to take quite a bit of public health infrastructure. So.
Thank you. And I'm going to come back to that right before we wrap up. We're getting towards the last 5 minutes. But Dr. Walter, I'd like to stay with you for a second because we've had a question about, as families think about gathering for Thanksgiving, Christmas and other holidays, how hopeful are COVID tests Is it worth somebody, if they can get access to a test, getting tested beforehand and using that as a guide as to whether it's safe to be around other people? How much trust can we put in that as we plan?
It might be somewhat helpful in some situations, but I don't think we can be fooled by totally by testing, because if somebody may have been exposed and may not yet totally have developed infection. So if you test them too early, you may miss the test positivity. So I think it can be reassuring, but potentially falsely reassuring. So I wouldn't put all my stock in testing. So
we've had two great examples of that, Greg, that contrast beautifully according to what Chip just said. The first is good effective use of testing when combined with really rigid mitigation within athletics. And there's been a lot of groups who've done that very successfully. And yet the contrast is daily testing, which failed to control a really significant outbreak that happened over the last month up in DC at the White House. You can't do testing by itself and expect that this will get you out of a problem.
Sure, thank you very much for that. Dr. Martinez, would you like to add anything to that?
Yes, you have to do the prevention and mitigation. We have measures. We know that wearing a mask, doing good hand washing, and keeping distance really helps us to avoid the transmission. So you can't just do testing alone will not do this. We need to do these measures to prevent passing it along. It is just extremely important to remember that the most important element that we have right now is to wear a mask. If it wasn't for the mask, everybody at our health system will be sick, right? We are wearing masks to prevent us health care workers getting sick, and it's working. So just do it, because it really will prevent getting sick and passing it along.
Greg, it may actually be worth doubling up on that and sharing with folks an article that was put out by Infection Prevention here in the hospital that showed really the time point that we instigated mask wearing amongst all of our healthcare workers, who presumably more than anyone else are exposed to COVID on a regular basis. And our employee rate of infection completely plateaued at that point with that single intervention. It was really quite a profound difference. And I'd be happy to share that article if folks wanted. It was really meaningful.
Yeah, please, Dr. Wolfe, if you'll share that with me, then we will send it out along with the link to the video to all the reporters that joined today. So that will be in there. We're about to wrap up here, but Dr. Walter, I'd like to come back to you. You are obviously Chief Medical Officer at the Duke Human Vaccine Institute. And I think a lot of people are wondering, it's like, okay, we need to make sacrifices this year. We need to lock down and the holidays won't feel the same. What are the chances that maybe by next year, with the current vaccine timelines that we have and with lots of fingers crossed, that the holidays might seem more like normal? Or should we be prepared that large gatherings that we see at the holidays, there's going to be a new normal for the foreseeable future, maybe for several years?
Well, that's a really good question, and one I don't have the crystal ball for, but I think we are hopeful. There are many candidate vaccines that are in the pipeline that are being tested in large scale trials right now. We're doing some of that work here at Duke. I think we should hopefully have some preliminary results from those studies coming out later this year, maybe as soon as sometime next month, late next month, that we'll start to see some results from. Obviously, it's a really complicated situation because there are many vaccines out there. Not all of them will come to market or come to be available, excuse me, I shouldn't say market, but come to be available at the same time. There will be limited amounts to start off with. So there are allocation plans to distribute vaccine that are being developed by the CDC and the state health departments. So I think we will see a gradual rollout of vaccines next year, probably I'm hopeful that by mid next year, that we'll have a broader dissemination of vaccine in the population. And that maybe, once we get through this second surge of infection and we have a vaccine by mid next year that's fairly widely distributed, that things may normalize a little bit more and be a lot better towards the end of next year. Does that mean we'll be back to normal? I don't know that I can guarantee that at this point. I mean, we may be somewhat in this situation next year, but I think we'll be sitting a lot better late next year than we are currently.
Well, thank you very much for that. And I think a shred of hope is as good a place as any to leave it. We've reached an hour, so I think we'll leave it there. Thank you, everyone, for joining us. Thank you to our panelists, Viviana Martinez-Bianchi, 𝐓𝐡𝐞 𝐏𝐚𝐧𝐞𝐥𝐢𝐬𝐭𝐬, for sharing your perspectives. Next week's briefing returns to the subject of the US election, by which time Election Day itself will be less than a week away. If you'd like to be on the list for future briefings, please email news@duke.edu to let us know. In the meantime, today, I think we've learned that Zoom hoarseness is a thing and that you should listen to your doctor, and overall, please wear a mask. So stay well and be sure to vote. Thank you very much and have a great day.
Thank you.
Thanks, Chip. Thanks, Viviana.
Thank you so much.